We're educated in that stuff and we can help with that. Where our value add comes in is making sure that the communication from the brain via the peripheral nervous system is as crisp and as clear as it can possibly be to that muscle, so that you're not going to tear it, you're not going to pull up, you're not going to get injured. So it becomes injury prevention and performance enhancement rather than treatment management and repairing damage. And that is where the nuance is, because I'm very fortunate. I've got probably 20, maybe 30 physios who refer to me regularly. And we have a very good understanding and a very good professional relationship. The patient gets said to me, it's said through this physio, I know exactly what I need to do. I need to restore the mechanics and the neurological patterns that injury, and the patient goes straight back to refit. After my job, the physio carries on with this. And that's how it should be. There should be this resonance and this cross-patterning in a multidisciplinary environment for the improvement and the betterment of that athlete and that patient. As much as I'm happy to treat sports injuries, I get more passion and joy out of seeing a patient who doesn't get injured and can perform at their best time in, time out. That's where we need to be. We shouldn't be having reams and reams of patients on our beds because they're torn hamstrings and torn ligaments and all the rest of it. It's usually because of a breakdown in communication or a change in the biomechanics. And if we're not addressing those, that athlete's just going to get injured again.
Achilles tendons you mentioned. If somebody has a hamstring pull, what tips and advice if they have it and they're suffering from it now? They come in, they see a chiro, physio.
Your hamstring analogy could be any other muscle in the body, same sort of thing. So your approach is obviously, say there is an injury. You got a grade 1, 2, or 3 tear. The research seems to say that compression is actually better than ice. I'd get some compression and some ice on there. Ice definitely makes a difference, whether it's psychological, physiological. Ice definitely makes a difference. Compression makes a massive difference. So the sooner you can get compression on that tissue, reduce the swelling, tame the swelling. It needs to be firm. It's not to the point where you feel like you're strangulating the tissue. It just needs to be firm. That firmness contains the extent of the inflammation. If you don't contain that, the inflammation is allowed to proliferate into that tissue, and it'll go as long as there's swelling or bleeding or whatever. It'll keep going until it stops. So the sooner you can put the compression on there, it's a bit like if you cut yourself. Get some compression on there, and the wound sort of firms itself up and the bleeding stops. Same sort of concept. Get the compression on there, contain the swelling and the inflammation. And the ice also helps with that. So initially, we want to try and contain the inflammation. The quicker we can drop inflammation down, the quicker we can get the healing process going. There's one caveat. We like to take anti-inflammatory, just it stops or breaks down, slows down the inflammatory response. The way it does this is on a chemical level. And on a chemical level, it now disturbs the next phase of your healing. And you feel better because there's not so much swelling. But the next phase of how this tissue repairs and recovers and you rehabilitate is now being controllable.